All right, so it's a 501. I'm gonna go ahead and get us started. First of all, I want to welcome everybody that is joining us for this program on, and we've loosely described it as how to follow healthcare legislation. And this great idea was one that was hatched by uh, three folks. And by the way, I haven't introduced myself. For those of y'all that don't know me, I act like everybody knows who I am. My name's Kirk Watson, and I am the founding dean of the Hobby School of Public Affairs at the University of Houston. And this time last year, I was a senator representing the Austin area in the Texas Senate. And I left that position. In fact, I announced in February of last year that I was leaving that position in order to become the founding dean of the Hobby School. So I have a special interest, if you will, in how healthcare legislation becomes a law. And in talking with Dr. David Buck at the University of Houston uh, College of Medicine, and then talking to my longtime dear friend, because I have a special place in my heart for the Dell Medical School at the University of Texas, the three of us hatched the idea of using the hobby school as a way, if you will, to educate those who are in the educational system trying to become doctors at U of H Medical School or at Dell Medical School, or pharmacists, optometrists, nurses in the different colleges at U of H. Give them the opportunity to hear in kind of a nuts and bolts, very casual way, the best way to follow legislation and be able to keep up with it. And so that's how this came to pass. I reached out to my good friend, somebody that I've served with in the Texas Senate for some time, Senator Lois Kolkhorst, who just happens to be the chair of the Senate Committee on Health and Human Services, and told her that what I would love to do is have her committee director, who is an expert in how these bills get through the system, Bryan Law, who is with us here, if he would be willing to help us out with this. And he's somebody that I've enjoyed working with. He's been with Senator Kolkhorst a while. I served on the Health and Human Services Committee for a while in the Senate. I also served on the working group for the budget for Health and Human Services, and that's where that's where they lock us in a back room, and nothing transparent actually happens in state government at that point. But he and I used to work pretty closely together and actually have some fun together on things like this. So Bryan his title is he's the committee director of the Senate Committee on Health and Human Services, the one that I mentioned Senator Kolkhorst has been the chair of for more than a couple of sessions. This is Bryan's seventh session working in the Texas legislature. So that tells you he's got quite a bit of experience. He's worked both in the House and in the Senate. He has worked, he's got a broad experience because he's worked not only as like a committee director, which is a pretty high position of authority in that Capitol building, but he's also worked on the staff of committees over those 7 sessions. But he's also worked with specific members in their offices. So he's got a real breadth of experience, and it's one of the reasons I'm happy to have him doing this. In fact, his experience has led him to teaching government at Austin Community College, and he's a native of West Texas, near the Abilene area. Grew up in the Abilene area. In his spare time, he likes to spend time up in the mountains and be out there in nature. But right now, nobody's out in nature. You work at the Capitol because you're busy with the legislative session. The legislative session just started. It's a different session than anything anybody's ever seen because of the pandemic. And we'll talk a little bit about that. But Bryan, thank you for doing this. For those of you that are watching, here's what I would like for you to do. I'm going to start asking Bryan some questions, and I'm going to let him run a little bit. He's the expert. But in addition to that, I want, and he does too, if you've got specific questions, we would love for you to use the Q&A function on Zoom here and put those questions up. I will do my best as we go along to just pull some of those questions up. But for certain, toward the end of this thing, I'm just going to go to those questions, and you all can ask questions and get answers to them. If we finish before 6, as I told Bryan before we started, ain't nobody grading our papers. Nobody gets a grade on this, so who cares? We'll finish early if that's what it takes. But I don't think we probably will. Bryan, thanks again for doing this, and let's start off with this. This is a different session. And most folks kind of know how a bill becomes a law. You have to pass it in the House and in the Senate, or vice versa. But with a session that is, it seems to be kind of starting more slowly. Am I reading that right?
Way more slowly. This is back in the day. I mean, a lot of people wonder, why does Texas meet every only 2 years? Why do we take so long to get going on making bills when we are in session? Well, back in the day, people had to come down by horse. They had an agricultural calendar. So, back then sessions started off slowly because people were slowly coming into Austin to vote and pass laws. In the more modern era, we don't have to do that. But in prior sessions, we are really humming by this point usually. Usually committees have met for weeks, bills are being referred. We have a lot more progress happening. Unfortunately, due to the pandemic and social distancing and testing that we have to do at the Capitol and all the protocols we have to take, both the House and the Senate are taking a very slow approach to preserve the safety of both members, the staff, and guests that come to the Capitol. So unfortunately, all those protocols have slowed us down substantially. The good news is that both the House Appropriation and Senate Finance, the two committees that handle the budget, which is the one bill we have to pass constitutionally, they are working, and they are working hard to on both the House version of the budget and the Senate version of the budget, because at the end they've got to reconcile those and pass one budget. So that's where we're at right now. None of the policy committees have met yet, but the finance committees on both sides of House Appropriations, Senate Finance are meeting as we speak.
Well, you answered right there at the end. I was going to ask you, have the substantive committees, Health and Human Services and Business and Commerce and others, have they met at all? And you're saying they haven't. Now, I think Business and Commerce in the Senate, and there's going to be 2 committees in the House meet tomorrow to talk about what happened last week.
That's right.
To start looking into that. But even then, it takes an unprecedented crisis, I guess, for that to happen.
That's right.
I want you to back up a second, too.
Sure.
Because something else. Because of COVID, the committees haven't met during the interim the way they normally do. Will you explain? Will you explain kind of what happens during the interim with committee work that leads into getting up and running as we start a session?
Absolutely. So as I mentioned earlier, the Texas legislature, and every state's different, the Texas legislature meets every 2 years. My old boss, Representative Susan King from the Abilene area, used to say, odd people meet on odd years and make odd decisions. And so that's how it is in Texas. So we're in 2021. The last time we met was 2019. And in between that time, it's called the interim. And during the interim, both the lieutenant governor and speaker on the House side, the speaker, the Senate side, the lieutenant governor, issue charges or top priorities that they think those committees should study and come up with ideas and solutions for the next legislature. So the 86th legislature, which was in 2019, got these directives, these things from the lieutenant governor and speaker to study. And we were in the process of doing that when COVID-19 hit. And so literally I had a whole interim hearing that was planned, all the panelists, everybody was ready to go. And we had to cancel that meeting. And the Health and Human Services Committee did not meet again. That was in March of 2020. The Health and Human Services Committee could not safely meet again until December of 2020. So that's that. We lost a whole interim essentially of really studying some critical issues facing the state.
Yeah, that's the, I have strong opinions about whether we meet too rare, whether the legislature meets too rarely in a state this size with some of the needs it has. But one of the advantages, if you can argue as an advantage, is that the interim usually serves as a good time to catch up and do homework, to actually
Absolutely.
go in depth on something, because you know it's harder on that 140 days. But what you're saying is that COVID has kept us from even doing that. So another basic question: we know a bill becomes a law when it passes both chambers and then goes to the governor, and the governor doesn't veto it. The governor signs it or allows it to become law. Something as simple as somebody that wants to follow a bill, and they've been told, you know, old representative so-and-so filed this bill, or old senator so-and-so filed that bill. Two things. One is those bills get designated based upon where they get filed, right?
Right. So they, if they're filed in the House by a state representative, they are a House bill or HB. And if they are a senator and filed in the Senate by a senator, they're SB, so Senate bill. And there's different types of legislation. So you have what I said, the House bill, Senate bill. Those are pieces of legislation that change law. They change the state law that we operate under. Other pieces of legislation include concurrent resolutions. So you might have a House concurrent resolution, a Senate concurrent resolution, and those either like direct a certain action, or they express a certain sentiment, but they don't make law. They have a legal importance, but they don't change the law. And then you have the favorite resolutions, simple ones of all senators and state reps to recognize people from their districts and to commemorate when people pass away, or to designate a day that we want to celebrate as Texans. So there's different types of legislation. And the last piece is the constitutional amendments. Sometimes you have to change the Constitution and get authorization to change the law. So there's HJRs, which are in the House, that's House Joint Resolutions, and SJRs, which are Senate Joint Resolutions, and the voters have to approve those for those amendments to happen.
I love how you refer to the kind of favorite resolutions that in the Senate, we actually had to change the rules so that senators can only do a certain number, because
they're prolific. Yeah.
The senators like to talk, and they like to honor everybody in their district. It's a nice political maneuver. But one of the key things I want people to hear in what you just said is that SB's, S as in Senate bills, H as in House bills, that's how they end up getting designated. And many times, tell me if you agree, but what happens is that something that a member of the Senate thought would probably end up being a Senate bill, but because of the way things work during the session, and in this session with the way things work, it may end up that they end up being the sponsor of a House bill that achieves the same goal that they thought they were going to do when they authored a Senate bill.
Right. And this might be a good time to show the bill chart so people can see the process. So let me share my screen, and I will.
And by the way, while you're doing that, let me just say we've had one question put in the Q&A, and I will get to that because it's a really good question. But if anybody else has questions as we go along, put those in there because we'll come back to those. All right, go ahead, Bryan. It's up on the screen now.
Okay, great. So because we have former Senator Watson here, I'm going to start with the Senate side, and it's the same process if I flipped it and did it on the House side. So you can see when a bill gets filed, it has what's called a first reading, and that means it's the first time that it's read out loud in public, and that literally happens. The caption of the bill, which is basically a tag that says this is what this bill does, gets read, and then it's referred to a committee based on the subject matter. So for example, if it's a health bill, it's going to go to public health in the House and health and human services in the Senate. If it's a highway bill, it's going to go to transportation committees in the House and Senate. So that's how bills get sent to committee.
Can I interrupt you there a second?
Yes, sir. Yeah.
Because sometimes, I mean, the way you just did that is exactly right. If it's real clear, it's a health and human services bill, we know where that's going to go. But sometimes you may see what somebody thinks is a health and human services bill go to another committee, for example, state affairs or something like that. That's really just in the pure discretion of the presiding officer, right?
Yes. So every committee has a jurisdiction, so they should go to whatever that subject matter is. But at the end of the day, the lieutenant governor who runs the Senate and the Speaker of the House who run the House, they ultimately decide where bills go.
Got it. Thank you.
Sure. So you can see we get to the committee process, and this is the first place that bills can die. So committees are the first barrier that a bill gets to. So if it does not get a hearing and then it does not get a vote to move out of committee, it won't continue. It will go away. It will die. Essentially, because you have to have the bills move forward, or they don't have any legal importance or implications. So let's say that a bill does get out of committee, then it's got to go. It gets a positive vote, so the majority of the committee members voted out. It will go to the floor, and the House and Senate treat those differently. And I can go into that if you want me to.
Before we go to the floor, I want to ask you some questions about the committee itself.
Sure.
Since we're talking to folks that are primarily interested in health and human services, and that's why you have specific expertise, talk a little bit about, since you said it, this is the first place that you got to get it out of committee, but not all bills get hearings in committee.
That's right.
Not all, and I've had, over the years, I've had a bill or two where we had a hearing and I really did a great job, and I still didn't get a vote on that bill.
No, you didn't. Probably.
So talk a little bit about how that really works.
Yes, sir. So like I said, the bills get referred to committee. Once they're in committee, the chair of the committee is the one that sets the agenda and decides which bills get heard. So while there are members of the committee, it's not a just full-on collaborative process that way, where if a majority of the members want to hear a bill, then it's heard. A lot of times, that if that's the case, the bill probably will be heard, has a better likelihood of being heard. But once again, like I told you with the lieutenant governor and speaker, the final say really comes down to the chair of the committee and what they believe should be heard by the committee that week. Typically, and we'll see, I'm really hoping that once the Health and Human Services Committee starts meeting, we will have our weekly meetings like we typically have in the past. Those committee hearings are posted, and then the hearing happens usually the next week, like Tuesday or Wednesday. So usually posting on a Friday for what bills will be heard, and then that will be heard on a day next week. For example, last time we met on Tuesdays, and so to answer the dean's question specifically, how does that happen? How does a bill get posted for or heard? Essentially, the staff of the committee really look over, analyze these bills, provide pros and cons to the chair, provide which senators they know support the bill, provide which advocacy groups and constituents, people that live in the senator's district. All that information is provided to the chair before we post, the week before the hearing, to say which bills do you want to hear, and ultimately she makes that decision. So those are all presented in front of her, and then she will give us a list of what she thinks we need to post for as a committee.
So I want to ask you about that, because I literally early in my career, I had in the Senate, I had a bill where I went and got 2/3 of the members of the legislature to say they would vote for my bill if it ever made it to the floor, and I still didn't get a hearing on that bill. So I gave up on that bill. That bill never. I didn't try it again. But that what you just said, you raise an important idea. many times the member is going to the chair and saying, requesting a hearing. I'd like to have a hearing. And sometimes needs to show that there's support for that bill.
Absolutely.
It may have some controversy to it. You mentioned how you talk about what the pros and cons are. Would you describe, so that folks know, because it's important to how you influence the outcome of a bill, describe a little bit what happens with the staff of the members of the committee, or the staff of members that aren't on the committee, but their bill has been referred to that committee. So let's say it's Senate Bill 200 by Smith, and Smith's not on the committee, but that Senate Bill 200 is going to get a hearing, or could get a hearing. Tell everybody what the process is that doesn't get seen leading up to maybe it getting the hearing.
Sure. So a lot of people would be surprised that the first step is you have to putting a hearing request. And that's just a simple form that we send out, that if a bill is referred to our committee, that's you have to get that form and request a hearing. And so a lot of times we don't have a hearing request on your bill. And so we can't do anything without that. I mean, that's a fundamental first step that has to happen. If we get that request, that's put into the potential bills that we could hear. And the committee staff are broken into different subject matter areas. I analyze bills myself too. I handle the major agencies. We have HSC, dishes, DFPS, and then we have subject areas such as scope of practice, or hospitals, or nursing homes, or whatever area you want to label and categorize. We have break that up at a staff level and analyze those bills. And then typically what happens is, there will be a theme that will develop around, let's hear bills around that help people with disabilities, so that we have the same witnesses, the same resources, a lot of the same things at the hearing. We're not all over the place hearing something about, sometimes that happens. So, you can't help that when session gets further along, you just have to hear more and more bills, but we really try to conserve, where we can, and keep consistency, because it helps the members on the committee stay focused in one area and have the same resources to address multiple bills that talk about the same topic.
And you actually get cross-pollination with some of the testimony. Oh, I heard something on that bill that makes a difference in how I think about this bill. So right. So we it's not a rule or anything, but we do try to group bills together that have similar subjects and touch similar parts of the same code of law, so that we can have a more concentrated and in-depth hearing on those bills. And then once the policy analyst has looked at the bill and made comments about it and really looked at it, we like I said, we take the list of bills we have to the chair and committee and go over, and we usually tell the chair, these are the bills we have in committee, and then she directs us which bills she wants to hear more information on. That's great. When I grinned when you said that we got to get a hearing request first. There's a member who's no longer a member, who was chair of a committee. He's not there anymore. Who his MO, when he didn't want to hear a bill, was to always tell you he didn't get a committee request. He just look you dead in the eye. Committee request. One of the questions we have from the audience, let me ask you this.
Sure.
We talk so much about the discretion of the chair. How are the committee chairs decided?
Great question. So every time the legislature meets, so this is the 87th, the lieutenant governor on the Senate side is the one that decides who the chairs are of the respective committees. So this time we had, when Lieutenant Governor Patrick appointed chairs, this time we had some new chairs of committees. And then we had chairs that were from the last session for 86. So for example, Senator Kirk P was chair last time, and she was reappointed chair this time. And it's the same process on the House side. The Speaker of the House will establish those chairmanships, for their membership as well.
And there was some significant change this time, particularly over on the Senate side. On the House side, because we had a new speaker.
Right.
Something we ought to do. I should have asked this earlier, and I just didn't do it. You and I kind of tend toward this. We lean toward that Senate for obvious reasons. And the committee that you're the director for is the Senate Committee on Health and Human Services. What is the corresponding committee for those that want to follow health-related things on the House side?
Yeah, it's great point. On the House side, it's split up. I actually worked as committee director for the Public Health Committee on the House side back in 2011. And so the House splits out what we on the Senate side have all together. The House splits it out into House Public Health and into House Human Services. And so what that split looks like is public health is like, for the Department of State Health Services, mental health services, you get into maternal mortality, you get into different areas of public health, the COVID situation, and then on the human services side, you get into people with disabilities and Medicaid and nursing homes and more long-term things. I always think of public health as, you're dealing with a lot of acute, immediate situations. And then on the human services side, you're dealing with a lot of long-term programs and those with chronic needs and need those human services. That includes foster care, DFPS, CPS, things like that on that side. They don't always break down those categories neatly, but that's one way I think about it if you want to think the differences between the two committees and what they deal with on the House side. And it was always a toss up with a lot of different subject matters. Were they going to public health or were they going to human services? When you were on the House side. So that was always interesting because there was a lot of crossover over there. And then, there's a few auxiliary committees like State Affairs and Business and Commerce that handle things like health insurance or handle like auxiliary things that impact, health and human services. So, there's always connections to those as well.
So we've talked pretty good about it and generally about it's in the committee. It's when it gets to the committee and when the bill gets a hearing. And you mentioned that part of what happens is you might have a day where you talk about certain types of bills because that allows for expertise on this bill and that bill and the other bill. One of the questions we've got from the audience, which is a really good question that I want to ask you, is, and I'll just read it to you, any suggestions for helping individuals to assist members of the House and Senate and their team, because we've also talked about how important the staff is, the professional staff that helps the members, any way to help them and their team with any questions that they may have on an area about which we may know something or can be a resource, as with healthcare related issues?
Yeah, that's an excellent question. We receive a lot of information on a daily basis, and information management and how we analyze and synthesize that information is always a challenge. But one thing is just to offer yourself as a resource, either with a phone call or an email that clearly states like who you are, and just building that relationship with Senate and House staffers in the area you're interested in, and or specific policy you're wanting to see changed or support or against. What that does is if you build that staff remember, oh yeah, and on this topic I spoke with so and so, or I have an email from so and so. I personally try to keep those buckets of resources for different people, because I'm not always going to trust a state agency to give me the answer. Like maybe I need to talk to medical student so-and-so or doctor so-and-so to get a better on the ground expert opinion, because while we love our colleagues at Health and Human Services and the other state agencies, the legislature also doesn't rubber stamp what they do. We have to listen to experts, listen to the public, and be a balance to what the state agencies are doing. So that's a great question. My advice is always to try to build a relationship, and also to provide like very succinct information, whether it's a one pager or just very concise. Like I said, we deal with a lot of information. So while I went to grad school, I love white papers, I love in-depth research. And as the dean knows, the time constraints don't allow us to do the in-depth research in session. Maybe during the interim, like we mentioned earlier, but during session we need those. Just what matters, what's the key points, and so that would be my advice.
I think that's a great answer, and if I amplify something, and it applies not just to what might be going on with an agency, but you mentioned a minute ago an area that comes up a lot in health and healthcare, and that is scope of practice. And I'm just pulling that out of the air because you'd mentioned earlier, but bills that relate to things like scope of practice. People that have good ability to succinctly tell you what the issues are and why that argument doesn't really work. More than once in the Senate, I've heard myself saying to my professional staff, who do we talk to about that? Who knows about that? And they, like you, they knew who had come in. I want to also ask you to emphasize something about staff. Is it your opinion that if somebody wants to help on a bill, like that question just suggested, that they should only talk to the member?
Not at all. Not at all. I think it's important to, if you get to meet the member, of course, and introduce yourself and talk about what you care about. But that connection with the staff to really follow up and say and really fill in the dots and gaps of why you really are invested in the issue or the policy or whatever you're advocating for is really key, because that staff member, like I personally may not get to see the senator or the chairwoman on a daily basis just because of her schedule and her being on other committees and other obligations. So we may have the same goal of trying to share information with her, so.
That's a good point. I hadn't thought about it. Well, and I'll just say, part of the reason I'm glad you're doing this for us, Senator Colcourse and I have known each other a long time and worked great together. But one of the reasons that, I liked having my staff and you in those work sessions was because there were things we just didn't, and we worked hard at it, but we had to rely on you. And you were always great at having detail. Well, that becomes important. So the answer to the question includes get to know those staff people that are the experts. First of all, they're going to understand what you're talking about. And if they don't, they're professional enough to figure out how to ask you the questions to get you there.
Right.
So now the bill, it gets a hearing. We've already talked about they don't always get a vote, even if they get a hearing.
No, they don't.
But when it gets a hearing, boy, the stories I could tell about some of my bills that didn't get a vote. But the bill, then what happens to it once we've had the hearing and it's getting a vote? Talk about that.
Sure. So every week there's two processes that really happen at the committee level. The first process is the bills get heard. We talked about that. That's kind of that's the front side. On the back side, you have bills that probably were heard last week or 2 weeks ago, and they're eligible to be voted on. And so, usually what happens is at the very beginning of the committee hearing, when you have a quorum, which means you have enough members there to proceed to do the hearing, that's typically when you want to try to vote, because that's when most members will be there because they have to leave, they have to go off to other committees, meetings, constituents. And so that's your best shot to get the most people there to vote. And so usually at the first of the hearing, we'll have a list of bills that the staff have sent out per the chair again. The chair again is deciding what we're voting on. And so we will send out that list to member offices before we meet. to say this is what we're going to vote on.
Good. And something we ought to cover real quickly is sometimes there's a reason for a gap, right? I mean, between the hearing and the actual vote, and that is because you heard something during the quote hearing. Yeah, somebody actually listened, and so you're going to change the bill. I mean, that's part of the process. And so what happened? You have a substitute of some sort. Can you talk a little bit about that?
Sure. And I'll say 99% of bills filed get substituted. It's been, we haven't perfected getting policy right at the first shot of it. And so I can tell you,
Bryan, can I interrupt you there?
Sure.
So what you're also telling folks is that the bill gets filed, it gets its first reading, but even before you get to the hearing, it might be changed.
Right. And so that's called a committee substitute. And that's literally what it means. The committee is substituting out the bill that was filed. So that's what happens at the committee level. So when the bill gets a hearing at the committee, the chair will say, I lay out the committee substitute for the bill. And so then that's what matters at that point. The filed bill goes away and we look at the bill as substituted. And that's the changes that the author of the bill thinks, and their staff think need to happen to get the bill through committee. A lot of times it's not enough. A lot of times, as the dean knows, there's more work that either something came up at the committee hearing or something wasn't resolved by the time the bill was heard. And so then we might spend a week, 2 weeks, 3 weeks allowing that staff and that member's office to figure out how to fix the issues raised at the committee hearing.
And importantly, for those who, like the question we had about that want to be helpful, or that are just following the legislation, that I'll say this, and you tell me if you agree, they may think they know what's in that bill, but if they're not watching what happens at that hearing, there may be a committee substitute to that bill that changed it dramatically. Maybe
Right.
fixed or fixed something that they didn't like about the bill or hurt the bill as far as they're concerned.
Right. And I was going to tell everyone, if you go to the Texas legislature online, you can track any of the bills that you're interested in or see when committees are meeting. It's a great resource that you could use if you just Google Texas legislature online. It's called TLO. Click on that. It's basically a search platform to see all the bills filed this session, last session, and all the committee stuff that's happening. So why that's important for what Dean Watson is talking about is until the committee actually votes on the committee substitute, you don't see the text online. And so you have to get that from the member's office or from the committee. If it's laid out in committee, we can provide that as well, to people that ask. But, that committee substitute will not be online to view until the committee actually votes it out and publishes a report.
And I will tell everybody, because I don't normally tell my failures, but I've only had a couple. So, but I one time tried to change the Senate rules because I thought it was unfair to people that came to testify when they would come to testify and they were all loaded for bear to testify on a bill, but then a committee substitute came in and it was completely, and they would say, well, I haven't seen the bill.
Right.
I haven't seen the committee substitute. And I actually tried to change the rules. And that would be a good example of how something doesn't get a hearing. So, because my proposal didn't get a hearing. Now that we've done that, get us out of committee and then tell us what happens and how we follow it.
Sure. And I'm going to go back to that diagram just to help people visualize, because I know that helps me. So as you can see, once we get out of committees, more than likely, it gets out of committee as a committee substitute. So it's different than the filed version, but it's probably dealing with the same stuff. It's not going to be a completely different totally different bill. It's going to still be dealing with the subject it was filed on or the issue it was filed on. It just may have some changes that happened in committee. So on the Senate side, the committee report gets published, and basically it goes and sits in a bucket of bills that could be heard on the floor. And on the Senate, we call that an intent calendar. And senators can state which, basically let the lieutenant governor know which top bills they want to have heard on the floor. And it's really up to the lieutenant governor to put those, to call those bills up. And so that's how second reading happens. You'll see that icon with the thumb right here, second reading. That's where the bill is really debated. That's the main time when a bill could get amended on the floor or get debated among senators, is that second time that it's heard on the floor and laid out.
Can I interrupt you there? Because you
Absolutely.
Just
yeah.
Again, in terms of how a bill might not make it, even if the bill gets out of committee, even if it gets out of committee unanimously, and the senator who is the author or the sponsor of a House version of the bill puts it on the intent and puts it on intent and says, I want to take this to the floor. The lieutenant governor on the Senate side decides whether or not it's going to get to the floor no matter what.
Right. And on the Senate side, you have, the rule about, how many senators have to support the bill to have it come up. And so, that rule's changed, and, I'm not going to go into that, but that's there's a certain threshold. I believe this time it's 18 senators required to bring a bill up for consideration. And what that means is if you don't have the number of senators, in this case 18, you can't even get the bill up on the floor for the lieutenant governor to call up.
So on the House side, how does it, when it comes out of committee, and it's generally some of the same things, but when it comes out of committee on the House side, how do you get it to the floor over there?
Sure. And I'm going to stop there just to come back. So on the House side, they have a different process. So the House has 5 times more members than the Senate, roughly. So, there's 31 members over here and then 150 in the House. And so that's a lot of bills and members, right? So the way they manage it is, instead of it coming out of committee and sitting in a bucket to potentially just be called up if you have enough senators support it, the House has their own committee called the Calendars Committee.
Well, it has to go to another committee.
Has to go to another committee. And that committee decides which bills get put on the House floor. Now, of course, the Speaker has influence on that, but it's a more formal process on the House side. That committee will post which bills get to be voted on, have second reading on the floor of the House. And so that's a different process over there. There's also a local and consent calendar.
Bring that up. Good.
So if there's bills they'll have a local effect, they're only meant to impact a certain region or a certain city or county, those go to that local calendars committee to be voted on. And then, or if they're uncontested, meaning that everybody's just like, hey, we agree on this. There doesn't need to be a major hoo-ha about it or vote or debate. And so there has to be a vote, but not a major debate. It will go to the local and uncontested calendar on the House side. And then basically what happens is that's posted as a big list. And then it's like an auction. They read through them really fast. And that's an interesting process, because sometimes, even though it was not contested in committee, someone on the House floor, not on that committee, may not like that bill, and then they can knock it off of that uncontested calendar. So very dynamic process in the House.
Yeah, and on the Senate side, some bills go to to talk, if you will, about how bills may not go really to the floor, because they do go through another committee, but we have what's called a local and uncontested calendar there too. Right.
So on the Senate side, the administration committee will get bills that committees have referred to that are local and uncontested, and those bills will be put in pretty much a bucket or a stack or a list, however you want to look at it, and then they will be all together laid out on the Senate floor and read a second and third time and passed. So there's a little bit more of an informed process if there's a concern about a bill that's on that list. It's not as quiet as dynamic as the House side, where somebody just literally shows up on the House floor and says, I don't want this bill to be voted on today."
Yeah, and if a bill is in committee and it gets described for the folks that are watching, if a bill's in committee and let's say it gets a unanimous vote of the committee, what typically happens then with that bill? And then if it doesn't get if it doesn't get unanimity, what happens?
Yeah, so typically, sometimes you'll have the author of the bill or a member on the committee say, "Hey, we all voted for it unanimously. Can we just send it to the uncontested, the calendar on the Senate side, like I said, bucket or list?" And so, that's the chair has to do that. The chair says, it passed and recommended for this, uncontested side of things. On the House side, it's the same way, that at the committee level, when it's voted on, if you don't do that, it goes to the general way that we vote on things. You have to make a specific indication that this is designated for, on the House side, local, non-contested; on the Senate side, unanimously, locally agreed upon, to go to the administration committee.
And so one of the things that I always observed is that sometimes one person on the committee can become very crucial to the outcome of what happens with your bill, because they can keep it from going to local and uncontested, which means you then need to get that threshold number to get it to the floor. And then you're going to need to, it has the greater likelihood of being debated and issues raised with it. One of the questions that we had, and you're going to have greater expertise on this than most folks, what proportion of bills usually make it out of committee?
That's a good question. I can tell you in general, 20%, it was like roughly 19% of bills that were filed last time passed the legislature. And I'm not counting, there was the vetoes, but just passed the legislature. So 19 to 20%. I don't have the exact answer for you on that. It varies by committee.
That gives you a pretty good feel, because they got to get out of committee, right?
Right.
Yes.
So, I mean, I can tell you, we'll have hundreds of bills in our committee. I used to have the stats behind me, but I put them away, so we were moving to a new session. So when we ran the stats last time on it, basically, I think we almost got to half of the bills in committee heard, and then roughly under that, a percentage that were passed out. So the committee process is really, that's where a lot of bills just don't make it past that point.
Yeah. Dr. Cox asked a question, and as we come to the end of our hour here, let me ask you that. Her question was kind of what bills ought those that are interested in health and human services be looking for this time? I don't have it in front of me, because I closed it out so I can see you. But let me tweak that a little bit. What do you think, particularly in a session that's going to be goofy because of the situation we find ourselves in, what are going to be the 3 or 4 big areas that you'll have those day or hearings where you bring in multiple bills at one time?
Well, I could tell you, before the winter, that whole thing that happened, it seemed like that, the COVID-19 pandemic was going to be, the emergency top, thing. And then ERCOT and the power grid and all that happened. And so, it's the session keeps getting harder and weirder in ways on what's going to be priorities. The Lieutenant Governor issued his priorities, and that's important to mention, is both the Speaker and Lieutenant Governor give what's called priority bills. So those are usually bills that are 2 through 25, because House Bill 1 and Senate Bill 1 are the budgets. So those are the top priorities, right? And then 2 through 25 are more considered Speaker or Lieutenant Governor priority bills. And so members who get those designations will, when they file their bill, they get that number. And so, those are the priorities. You can see that'll help oh, this is what the lieutenant governor's priorities are. This is what the speaker's priorities are by the number on the bill. After 25, that doesn't mean that. But 2 through 25, that shows you priorities. I would say the 3 to 4 areas, of course, is the pandemic response and improving the response to the pandemic and lessons learned and a lot of we were talking about earlier, there was no interim hearings to really flush a lot of this out, but there is a lot of things that we've learned, not just from the state agency, but from the public, from providers, from doctors, nurses across the board, hospital systems, all these players telling us what we could do better or how state law could be amended to improve future responses to public health crises or disasters, things like that. I will tell you, access to care, I know is going to be a big issue. How do people get health care? How do they get how they get access to it? Who has what authority to do what to provide that access? That seems to be emerging as an important topic. And then, I would say, I'm just saying in the health and human services arena, the other issues, are the foster care lawsuit that the state is dealing with, and both how to improve child safety, but also increase capacity. Also implementing the federal changes that are coming with Family First, which basically is the Fed saying we're no longer going to fund congregate care. You have to move. You have to either prevent children from coming into foster care through services, or you have to provide it in a very specific way.
And at least on the Senate side, that's going to be a debate. There's some senators that have deep feelings that are different on both sides of that issue.
Right. So those are some top priority areas that have emerged.
That's a good list. As we wrap up here, I'm going to give you a couple of real quick. 2 people have asked basically the same question, which is, you and I have touched on this, and you did a good job of it, but I want to put it out there again. What deems a bill worthy of being heard? How do they judge which bills get heard or not? Go over that, and let's look at, and then the other question I want you to answer is from Dr. Buck is how do you identify a likely sponsor or member with a shared interest on something that's of interest to the public?
Sure. So on the what makes a bill likely be heard, that's I wish that was a more straightforward answer. Every chair is different. I've worked for different members. They all have different experiences, beliefs, and political affiliations. There's a lot of factors at play for why a bill gets heard. I can tell you, while bills can be heard more likely if there's a lot of support on the committee by the members, there's a lot of clear information about what the bill does. There's a lot of positive aspects of the bill that can be argued for. Things like that increase the likelihood, that the bill will be heard or could be heard. Again, it comes down to, I've had a lot of advocates that I work with, and I say, hey, look, I presented your case to the chair, and she said no, and she just will not post or hear for the bill. I've been on the other side of that, where I've worked for a member, and I feel like I made the best case to her committee staff and didn't get a hearing. So it really comes down to what the chair believes is what should be heard. And also too, her conversations with members on the committee matter, because I know it's not just one. She does have the discretion. At the end of the day, it comes down to what the chair wants heard. But I will tell you, those members on the health committee really influence that decision, because they talk. They talk on the Senate floor. They exchange, communications with each other. Their staff contacts us and says, hey, Senator so-and-so really wants this heard. And we relay that to the chair. So, that's all influencing factors.
So how does somebody find an author or a sponsor of something that they're very interested in?
One is, who is your state rep? Who is your state senator? I always encourage that, because you as a constituent, and when I teach government, I always teach constituents are the unspoken special interest group, because they vote, they decide if you should be there or not. So, I think being a constituent is very valuable. And so, you should, if you feel comfortable working with that person, that state rep or state senator, work with who represents you. But second, like if you go on if you go on the House website or Senate website, you can read bios and see if the something in the bio catches you. You can research their past legislation and see if they've worked on that issue before through the Texas Legislature Online resource I told you about. And if you find that they've had similar bills or done things, they would probably be more open to working with you.
And since I was going to have you bring up at the end anyway, and you just did it. You read my mind. Tell everybody again how best to go online to be able to track a bill.
Sure. And let me just share real quick the screen again. And I just want to show everyone what this looks like. Let me get to.
Yep.
So this is the Texas Legislature Online. You can see it's www.capitol.texas.gov. And if you want to search for a word phrase or just do a general search, you can type that here and click go. But look, we've got to change it. So it's got to be the 87th. So that's 2021. So that's the session we're currently in. Or if you're looking for a bill, you click on that. And let's say if we looked at the budget, SB1, we click go, that would show us everything we want to know about that bill, its history, who's authoring it, what's the latest action on it. Then you go to these tabs and you can click text to look at the bill, and then actions tell you what happened, and all these different tabs provide you all the information you need to know on that. So this is the great resource. You can see at the top here, House and Senate, all the information that's going on in each chamber, search options. You can look up each committee, who they are, when they met, and then calendars. You can look up what's being voted on in the House and Senate.
Wow. I served over 13 years and I never knew how to use that. I'm kidding. That's a joke. Here we are at the end of our hour. We're right on time. Bryan, you were great. I knew you would be. I want to tell everybody that's paying attention to this, and I know that last week fouled up schedules at the colleges and the schools. We've recorded this. Others will get to see it, and it'll be distributed by way of recording. I know, for example, at Dell Medical School, I think I was told earlier that after 11 days, this is their first day back. So, I mean, we had a weird week, but doing this, we've recorded it, and I appreciate you doing that. But I want to say to everybody, you see in Bryan an excellent example of somebody who has expertise that works every day in that legislature and makes a difference in how the bills turn out and how the laws get passed. So, Bryan, thank you very, very much. Would you please say thank you to Chairwoman Colcourse for me and tell her I said hello, and you stay safe and healthy. And everybody that's watching, God bless you. Stay safe, happy, and healthy. Bye-bye.
Bye-bye.